So there are a few different options for a patient who's struggling with arthritis. So medication is a very common way of trying to manage this condition. It has some pros and cons. Physiotherapy is often forms a mainstay of treatment, and things that I do that may be different to this is that I will examine patients and try to identify injection therapies that can help with the recovery of pain from arthritis. So there are advantages with regard to medications in terms of reducing the severity of the pain, but as people know, medications come with lots of side effects, and sometimes the side effects can be worse than the reduction in pain that you get from these kind of medications. Physiotherapy is very useful in terms of strengthening the muscles and ligaments that support a joint, but it can be quite difficult to perform if you are in constant pain. Where I would come in would be advice about medication and injection therapy. So injections can be very useful in numbing some of the pain. They can't cure the pain and they can't cure the degeneration. But if I'm able to get patients several weeks to months worth of pain relief, it may mean that they can engage in further exercises. And often, as patients say, they just need some time without pain to sort their lives out. And that's why injection therapy can be very useful for some patients. Flare-ups of pain can be very difficult to manage and they can be incredibly disruptive to the quality of someone's life. The mainstay of flare-up management would be with medications and physiotherapy, but I have performed injections for patients who have had flare-ups to try and reduce the pain, reduce the length of time that they have the flare-up and allow them to re-engage in exercises and just daily life. I think particularly with flare-ups, it's important to note the knock-on effect with your psychological health of being suddenly in severe pain. It affects you getting dressed in the morning, going to work, looking after your children. So it's important you look after your mental health during these periods as well. The best way of reducing the number of flare-ups that you have is to engage in a structured and regular exercise regime. A lot of flare-ups occur because a joint that has arthritis is suddenly asked to perform a function that it's no longer able to do. So if the shoulder has severe pain and the muscles supporting the shoulder become very weak, then even a simple thing can cause extra stress on that arthritic shoulder, and then you get a flare-up. So one of the important things is maintaining the strength of the muscles and ligaments that support these joints. And one thing that injections can do is reduce the pain to allow you and a physiotherapist to work on improving strength and conditioning. The NHS does recommend lifestyle changes for people struggling with pain, and arthritis is a very common form of this pain. The mainstay is making sure that you maintain a healthy diet and that you eat an adequate amount of nutrients of both proteins, carbohydrates, and fats, that you have a varied diet, including lots of vegetables. They recommend not smoking and limiting alcohol intake, and they recommend maintaining an exercise regime that will keep you fit and keep your joints in as strong a condition as possible. There's some evidence of certain changes in terms of diet that may be of more benefit for people who struggle with arthritis. This has not been well validated in larger studies, and probably more important is just ensuring that you maintain a healthy and nutritious diet.